Hey everyone, welcome back to the I Believe podcast. I'm Megan with the Cure in Sight, and we have a great guest today. We have Maya Skubatch. Welcome, Maya.
Thank you, Megan. Nice to see you. I wanted today to share the story of a patient that myself, not uveal melanoma, but I call it a sister, like an identical twin sister almost of uveal melanoma. It's called Blue Nevus Melanoma. 3 years ago, when I was 47 years old, I felt a bump in the back of my head. It was in my hairline. And if I thought I hit my head or something, I had just a bruise there, which was sort of odd. After a few weeks, I went to my dermatologist to have it be checked, and they said, "Oh, you have a blue mole. Blue moles are rarely, they're always benign, but according to CDC protocols, if it's more than, I can't remember if it was like more than a centimeter or two, then we'll take it out and biopsy it," which was the only reason that they did. Upon receiving the results of the biopsy, I was told that I have something called Blue Nevus melanoma. Never heard of it before. And when I Googled it, there's almost nothing available online that's directed to it. I was given a year of pembrolizumab or Keytruda as an adjuvant to prevent it from coming back. And the rest of it was just, well, let's just hope and pray it doesn't come back. Unfortunately for me, at the 2-year anniversary or about a year and a half ago, it did come back. And this time it was not superficial, it was internal. At that point, I went back to the internet and I looked to see if I could find other people with Blue Nevus melanoma. I could not find anything. There was nothing on Facebook. There was nothing anywhere. In fact, being seen at UCSF, they did not have any other Blue Nevus melanoma at the time. And then I started traveling around the country to places like MD Anderson. They said they've seen 2 other cases, and the doctor I saw, she said she saw 2 other cases in her entire career. So it's been a very lonely journey for me until very recently. And it has been lonely until it started by me doing sequencing on my cancer to really understand what the biology of it is. And it turns out that my cancer is genetically identical to uveal melanoma. So while the biology of it is identical, the difference is that uveal, as you all know, starts in the eye, and Blue Nevus starts in a blue mole. But it's the same genetic mutations and sort of similar predicament and progression. When my cancer came back, and maybe it's because it's not traditional uveal, and it became very clear that there's no clear standard of care. And I believe that also all the uveal melanoma patients out there are realizing that there's not a very clear standard of care, which is why these patient advocacy groups become so, so important. Patients will share more information with each other than doctors will, even with their own colleagues. And so it's imperative that we all stay connected and learn about the latest and greatest in therapies out there. Other than being a cancer patient, I just wanted to share a little bit more about myself as a person. After undergrad, I actually was a cancer researcher at Genentech, working in the lab on developing cancer medicine. And later on decided to pursue a career actually in law. And for the last 25 years, I've been a patent attorney, working with biotech companies, helping them develop their drugs and therapeutics. And so taking my my career has been my life for the last 25 years, taking everything that I've seen and experienced and learned and that has shaped me into who I am. I sort of see myself as somebody that's really championing the ability to not just sit around and wait for drugs to come up and be available to us, but really for us as a community to come together and consider what is it that we all need. I mean, we need each other, we need companionship, we need information, but we also need more therapeutic options. I think it's important for us to stay together on that front and really identify whether it's liver-directed therapies or systemic therapies or even targeted therapies. There are opportunities for all of us to help shape that. And I just continue to encourage people to stay connected with organizations like Ocular to support these efforts.
So let's back up to the nevus. We've heard nevus referenced as a freckle in your eye. I've never heard it, and I'm a layman, but I've never heard of it referenced as a freckle on the rest of your body. Can you have a nevus anywhere, or is it like in your eye, or like yours was on your head? Could it be anywhere?
So the Blue Nevus Melanoma um, usually appears somewhere on your upper body. So it could be a blue mole. I actually created a Blue Nevus Melanoma Foundation just to help people that have Blue Nevus alone just connect to one another. As far as I can tell, there's about 8 patients in the United States right now.
What's the website for your foundation
It's
or the name
called
of it?
Blue Nevus Melanoma. I think the website is like bluenevusmelanoma.org, but the name is Blue Nevus Melanoma Foundation. It's there for 2 reasons. One, there was not a patient registry. There was no way, there was not even a group for people to communicate with one another just on Blue Nevus. Melanoma Research Alliance is just so broad and it covers all melanomas, not just uveal, not just Blue Nevus. And so we get drowned out. Uveal melanoma, as you know very well, is a rare cancer. Well, Blue Nevus melanoma is considered an ultra rare cancer. There's about 2,000 patients each year diagnosed with uveal melanoma in the United States. It's not even disclosed how many are with Blue Nevus, but a paper from Arizona State University doing an epidemiology study identified about 150 patients over a period of 15 years. So it's about plus or
Wow.
minus maybe 10. To be an ultra rare cancer, it's less than 1 in a million people get affected with an ultra rare cancer. So for that reason, I had to create, before I even knew about a Cure in Sight, I created a foundation just to try to connect with others who have Blue Nevus. 2 people have signed on. So I do have now 2 colleagues, friends, but really from a therapeutics perspective, all of us are part of the same community as uveal melanoma. And why is that? Because genetically, the makeup and the way the cells present themselves, it's the same mutation. So in fact, I am benefiting from the one and only medication that is solely designed for uveal melanoma, which is Kimtrac, tebentafast. It's the bispecific T-cell engager. I've been on it for the last 8 months. I have weekly infusions, and it's been able to maintain my cancer primarily under control. It was not the first medication, though, that I was given. And I think part of it is maybe, again, slightly lack of standard of care, which it would be good to have more of in this particular rare form. So I am always shocked that the year is 2025, and with all the artificial intelligence that people talk about all around us, all of the power of genomics and proteomics and big data, that we only have one drug that is approved specifically for uveal melanoma. For Blue Nevus patients like myself, the only way I was able to get this treatment is because my husband just happens to work at Google, which is a self-funded insurance company, and they were able to get the insurance company, so in essence, override the insurance company because I was getting denials from our insurance company.
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
These are just some of the major obstacles that we all face. And we need to get drug companies to understand that what we have in common is all of us have a mutation in either GNA11 or GNAQ at position 209. And I think this position 209 is really critical to unify us. In essence, drug companies and pharmaceutical companies really should use that as a way to design drugs, and as the criteria, as opposed to calling it by uveal melanoma or Blue Nevus melanoma. I don't think anything that I say here will change their approach, but we are really the same cancer, just it displays itself for the first time in a different location, but then it progresses and metastasizes in the same way.
Does it ever go to your eye or does it go straight to the liver?
It goes straight to the liver, lung.
I'm so glad that you're here talking to us today because, like you said, being ultra rare, most people have never heard of ocular melanoma, much less uveal. And then blue nevus. I mean, I didn't even know what a nevus was, let alone a blue one. So, I mean, you were just getting like down and down and down into the weeds. So, I'm thrilled that you're here to talk about it because raising awareness of it is huge. That's our first line, is to get the word out there. And I hope that you feel very welcome in the uveal melanoma community because it is still, identically the same. And if it's going to be the same drugs and the same things, I hope that you feel very welcome and included in all of our communities.
I have been. And I think that the communities should be focusing on using our collective power to really, we need to demand medicine. This is, like I said before, the year is 2025. We have a lot of information available to us, and medicine can come in different forms. It can come in the form of immune therapy, like vaccines, cancer vaccines. There is a Moderna phase 3 clinical trial right now called Keynote, but it's for really cutaneous melanoma, and they would not take people who are on active cancer. Hopefully, they will be able to progress and actually not only treat the healthy, but treat people who have cancer. And then, so there's vaccines. There is targeted therapy, like liver targeted therapy, that needs to be fully understood. And Megan, I don't know if you want me to go into great details, but there's so many options out there. And I find that a lot of patients are not always aware of all the different options. Some of these options are available just on sheer fact of location. Certain hospitals will offer procedures like galvanize, which is a pulsed electric field treatment. Other hospitals offer histotripsy, which is ultrasound treatment. Others offer only immune embolization. Again, different facilities offer different treatment modalities. And when you talk to a physician, and this would be specifically an interventional radiologist physician for directed therapy, you need to find out, it's like shopping, not only what's available at your store, but what's available across the country, because they do not regularly share this information more broadly.
Yeah, it's definitely hard. We do try to keep up-to-date clinical trials on our website at cureinsight.org. So always check there because a lot of times if you Google clinical trials for uveal melanoma or blue nevus melanoma, just everything that has melanoma will come up. It's not going to filter it for you. So we do try to keep a running list on our website. And again, we do our best to keep up with it. Kevin does a great job with it, but there's always going to be something else. So yeah, we all are always looking and trying to figure out what's the best for you, not necessarily what all is out there, but there are choices and you do have a choice and you should shop around and get, second opinions and third opinions.
Absolutely, completely agree with that. So yes, I'm on Kimtrack. It's weekly infusions. In the past, I've tried Ipi-Nivo and Opdualag. These are the traditional checkpoint inhibitors. They did not work like they don't for most uveal melanoma patients. And when I sort of reference the fact that I think that there's maybe not a good standard of care, the one uveal melanoma patient that I know personally who has overcome it just started directly with Kimtrack. So I think even the order of operation, as I refer to it, the order in which treatments are given should be given weight and thoughtfulness.
Yeah, no, that's
Sometimes
the
it's
order
not
is
just,
very important.
yes,
Yeah.
I personally, in hindsight, would go with whatever has the highest likelihood of winning as opposed to better quality of life. And I think that decisions
Mhm.
for me were made based on, well, what would be maybe smaller chance of winning, but easiest from a treatment perspective. Different approaches and different oncologists would lead you through different decision making just because of simple things like that. I also think that you'll hear a lot of things about not creating Swiss cheese of your liver and the like. There are still opportunities for you to do various directed therapies, and I think it all depends on location. And it's not the one shoe fits all. The other things that I've explored in the past including using companies like Tempus or Sengen, where you could take a biopsy and they would actually do a drug screening specifically based on your biopsy. Now, what I find, and they actually came up with very interesting results for me, and some drugs, some approved, some not approved, both appear to be very helpful. I've not used any of them yet. I kind of did that as a last resort to know if there's something that there's no clinical trial on but could be useful for me off label. What I think would be interesting again is if a group of uveal melanoma patients all ended up using Sengen. In essence, my guess is that again, this is me speaking, just a guess, that we would have a lot of overlapping molecules, and at some point we should just use our collective knowledge on that, or really have companies like Tempus do a study just for uveal melanoma, right? There's
Hmm.
power in the numbers, and if each one of us feels like we all have to do a biopsy for the same exact information, then that's very unfortunate.
Totally agree. How long have you been on Kimtrack?
So I've been
You
on
said eight
Kimtrack
months?
now for 8 months,
8 months.
and I'm planning to continue staying on it for as long as it primarily holds everything under control. I have had small things that maybe did not respond to Kimtrack, and I will, either radiate them or just take them out if it's just easy and accessible. So I think it's really important to keep everything under control. If you can do it systemically, then you're getting the systemic effect, which is good, but then not letting anything go out of control. I think that's kind of been my motto.
Let's talk a little bit more about the struggles that you've personally dealt with. Are there other ones? I'm sure there are.
You know, I always got really frustrated when certain doctors will not see you unless you're there in person. And
Oh,
there are facilities, and I'm not going to name them, but they won't meet with you on Zoom. And I find it frustrating
mm,
because it's not about my overall, my blood pressure, and it's not my temperature. They don't need to touch me. Everything that you need to see about me is all through images in any event.
it's true.
And I think that's been a huge obstacle. It's not just the cost of traveling. It's that if you're feeling tired and feeling sick from all your treatments, to have to then fly across the country just for a 1 hour doctor visit, if at most, then it's time, it's money, and it's energy that is required to do all of that. So that's an obstacle.
Up and
Um,
like time off work if you're still working or time away from your family. Time is precious.
Time is precious. Time is precious, right? And when we're not,
Yeah.
we need to all continue living our lives and being positive and happy and having it as much as we can a normal life. So if a 1 hour doctor appointment turns into a 24-hour travel plan or 48 hours, which I've had before, it's not really helping the patient. So I think these institutions that are forcing us to travel need to really think about, are they trying to help patients? Like what is their mission? What is their purpose?
Yeah, and why is the reason? Is it insurance or is it they're
No,
just
I've
their
been
own
told that it's
policy?
for example, in Pennsylvania, that they're telling me that it's the like not the AMA, but the state. There's like a state bar
Oh.
for the doctors that requires them to only treat patients in person. And
Mm.
always wonder if either somebody can change that or have exceptions to it, right? You need to have like reasonable exceptions to it so that physicians can have a phone call. Like I bet they would with their own family members. If a family member was out of town, would they not give medical advice on a phone call? I think they would. So I think we should deserve the same level of respect as they would probably give their family members.
Yeah.
So that's a major obstacle that I think many of us face. In the Blue Nevus particular space, my challenge too is not only was I not able to get the one drug, I think any clinical trial too has a lot of exclusion criteria. You've got inclusion and exclusion criteria, and Blue Nevus melanoma is not always an included criteria. And so I'm always terrified, like what happens when this drug really stops working? I'm scrambling. Not only it's like finding a clinical trial, which already sounds scary as it is, but one that also will have me as an inclusion criteria, or not me, but my cancer as an inclusion criteria. So that's a huge, huge obstacle. And then lastly, I have been really focusing a lot of my efforts, again, just because of my background and my professional career, in trying to start a company to develop therapeutics for Blue Nevus and Uveal. And I'll say that the funding is very challenging. Now, we all know that the economy right now is maybe not in its height, and probably many of you guys have seen that VCs are pulling back from making investments. Companies are sitting on their cash. But in general, I would say, even without such times, rare cancer is not an interest for most companies. That's just a fact.
Yeah.
Rare diseases, rare cancers are not an interest to most companies. Most companies are looking for big indications like obesity, diabetes, arthritis. And I think this is where it's important for us to band together and really demand and use all of our collective resources and connections, whether it's knowing people at a pharma company, knowing investors, people who want to invest in the space, and really making sure that our community has more drugs available to it. We need more
Yeah.
opportunities, more shots at goal.
Yeah, totally. So important. I agree. And the funding is a huge problem in all rare cancers. I can only imagine ultra rare. But yeah, I mean, I love your idea about banding together and having the voices be heard. And anything we can do to help, you let us know. I mean, we're trying to get the word out as much as we can. But if you come up with other things with your foundation, we are so happy to partner with you and help you in any way that we possibly can.
So I just emailed multiple just profiles about companies they have an open IND for different cancers, and this is in the vaccine space. This is just as one example. I sort of see vaccine as one vertical and targeted therapeutics as another vertical, and maybe even medical devices is another vertical. But even within the vaccine space, there are multiple companies that have an open IND. They're not focusing on uveal melanoma, but if there's enough of us sort of saying, we want to invest in the company, or we want, but we are demanding that you do this. There is support for
Mhm.
this. There's going to be funding available for uveal melanoma trial. I think it can get done. I'm positive it can get done. If there's a will,
Oh,
there's a
I like
way.
it.
I'm a big believer. If there's a will, there's a way.
Absolutely. I love that. Yes. All right. So let's go forward. Let's talk about some of the opportunities and the hope that's on the horizon. We've been through our struggles. Now, what are we looking forward to?
I would say that there are a few companies that would be maybe interested in this, and there are some scientists that are focusing on uveal melanoma. And I think that with this community, with efforts like what you're doing, Megan, right now, that we can get funding directed to create such drugs. So I'm literally spending most of my days thinking about it and working on it, and developing, pushing this forward. It just requires a lot of push. And anybody that wants to help can reach out. I'm happy to tell them more about it offline.
Absolutely. And we will link your foundation as well so they can get a hold of you. Is there any other way they can get a hold of you? Are you on socials or anything?
I'm not really, so that's, yeah, I'm old. I'm 50.
No, you don't need that drama.
I'm unfortunately not. So
So what website's the best?
yes, or my email, which is first initial last name at gmail.com, or
Okay,
MSKUBATCH at gmail.com, Maya Skubatch, for Maya Skubatch at gmail.com. So it's mskubatch
perfect.
at gmail.com. So anybody can reach me on my personal email. Anybody can, if you email the foundation, the Blue Nevus Melanoma Foundation, those emails go directly to me. They get forwarded to my personal email.
Well, that sounds amazing. I hope that everyone will band together and we will do some amazing things and move some mountains. So that's very exciting.
We have to move mountains, but that's really what it requires. And it needs to be strategic so we're not wasting our energies in moving them out.
Yes, and I think banding together is the core thing that we really need to get through people's heads is we're not trying to come up with all these different ideas and go in different directions. We all need to band together and do this together. And cooperation is the biggest thing we need in the whole community, whether it's, just people as people or a cancer community or whatever. Like, we need to be on the same page. We need to do it together.
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late stage development for primary choroidal melanoma and in early stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
And I should say this has been done before. There have been other foundations for rare cancers where there was no drugs available to those cancers. And with sufficient focus, fundraising, of course, and leadership, it can be done. This scientifically can be overcome.
Tying into that, we are doing a summer campaign called Sight for Life. If you guys want to join that, you can find it on our website, and we are trying to raise $100,000. A Cure Insight does fund research for this reason, to move the needle and eventually move the mountain. So you don't have to give from
the
your
race in Palo Alto. I know there's a run. You guys do these runs,
Yay!
which I think are amazing
Yes.
opportunities to get the community engaged. So I'll be there on Saturday with my
Yes, and what I
family and my friends.
Awesome. I'm excited about that. And what I hope people realize is whenever we do these fundraisers, whether it's Sight for Life or Steps for Sight or the 5Ks, invite everyone you know, put it out to your whole community, and let those people donate. We're not asking you to fund your own cancer. We're asking you to fundraise so that we can appeal to friends and family and neighbors and people who, there's a lot of people that want to pay it forward and they're like, hey, I want to donate $100 this month. I just got to figure out where I want to put it. And then your post pops up and they go, oh, well, that's my friend. I want to support her. I'm going to put it there. Sometimes you'll tip a waitress an extra $100. There's a lot of people that want to do that, pay it forward. So share and let them have the opportunity to help us move this mountain.
That's right. That's absolutely right.
Yeah.
That's absolutely right.
Share it. Yeah. So fundraise, share. If you need help with making a fundraiser, contact us at A Cure Insight. We always have a platform available for you to make fundraisers. You can even do Facebook fundraisers, and we can put that all in whatever bucket you want. When if you want a private fundraise, you can say where you want it to go. There's so many options. Is there anything else we want to hit on? Did we cover it all?
I think we did.
All right, Maya, thank you so much for joining us today. This was such a great conversation. And thank you for bringing us information about Blue Nevus that I didn't even know existed. So I'm so thrilled that we're able to get this.
If you see a blue mole on your body, you take it out.
I never heard of a blue mole.
Take it out.
Yes. Okay. So everybody go do a skin check. Call your dermatologist, do a skin check, look for blue moles, make sure you don't have one. And if you do, take it out. And Maya, thank you for bringing us this awareness. This was so, so valuable. And we will link all of your information in the show notes. And everybody, please go follow Maya. And we will see you guys all next time. Do your skin check. Thank you to all of our sponsors. Before we go, I do want to thank all of the sponsors. This episode wouldn't be brought to you without our lovely sponsors. And also, please go to acureinsight.org and sign up for our newsletter. Subscribe to our YouTube and our Facebook, and we will see you guys next week.